Okay, so today we are going to understand the various foramens of the skull and the structures passing through them. Okay, so let's start with this wonderful picture where we have two views. On the left side, we have the interior of the cranium. Okay, on the right side, we have the base of the skull. Why? Because some structures are visible on the interior, some structures are visible on the base of the skull. What all structures are passing through them, we'll understand. Okay. So let me just zoom in a little bit so that you are able to see them more clearly, right? Let me know if you're not able to see clearly. Are you able to see clearly now, Neha?
Yeah. Yeah.
Okay. Now, if you see, the first canal is known as incisive or incisive canal. The structures passing through them are nasopalatine nerves and nasopalatine artery. Anybody who can tell me which nerve branches are nasopalatine and nerves, which branch of the main nerve is this nasopalatine nerve a branch? Neha. Any idea?
Uh, maxillary division for
Yeah,
trigeminal
this is a
nerve.
part of, yes, right,
Maxillary division of
maxillary
trigeminal
division
nerve.
of the trigeminal nerve. Okay, I have also written here, I believe, right? Okay, so let me just take the pen. Now this is the incisive canal. Are you able to see in this view?
Could you
Neha, are you able
please
to see? Huh?
zoom in view is much better.
Okay, because I won't be able to use the pen in the zoom in view.
Oh,
That's
okay.
okay. Let me just
That's
zoom in
fine.
again. Let me just zoom in again. No problem. Okay. Now the next is the greater palatine foramen. So this is the greater palatine foramen through which the greater palatine nerves and arteries are passing. Again, they are the branches of the maxillary division of the trigeminal nerve. We also have the lesser palatine nerves, again, which are branches of the maxillary division of the trigeminal nerve. Now, there is a foramen which is known as foramen lacerum. Okay. Now, if you see, let me just show you a better picture of this foramen. You will understand it much better here. Now, if you see on both sides, this foramen, the oval structure is known as foramen ovale. Okay. This foramen is known as foramen spinosum. So this is ovale, this is spinosum. On the medial side, we have a big foramen, which is known as foramen lacerum. Okay. So there are very important structures which are associated with this foramen lacerum. We'll read it. Foramen ovale, foramen spinosum, and here we have the foramen rotundum, which is not very clear here, but I can show you in another view. We'll see that. So to remember, always like remember it like this. Let me just write it down for you so that you never forget it. Okay. Okay. So this is the foramen ovale. This is the foramen spinosum. Here we have the foramen rotundum, and here we have the foramen lacerum. So you can remember ROSE, rose. So rotundum, ovale, spinosum. And then in the middle, it is lacerum. Okay. So rose for the lady. So the lady is in the middle. So we have a rose, right? So ROS, rotundum, ovale, spinosum, and lacerum. Okay. So let's go back. Let me just undo this. So we are back to our original picture. Let me zoom in again. Now we were at foramen lacerum. I believe now you have a basic picture of the foramen lacerum, right? Neha, are you there?
Yes.
Okay. You can keep your mic on unmute. It's okay. Okay. So the foramen lacerum has two very important nerves. One is the deep petrosal nerve and the other one is the greater petrosal nerve, right? Now, the first one, which is known as the greater petrosal nerve, right? This nerve is a branch of facial nerve. Now, if you see, what is happening? What is, one second. Okay. Okay. So the deep petrosal nerve, which is a branch of facial nerve, the deep petrosal nerve, which is a branch of facial nerve. Sorry for all the technical interruptions, which is a branch of facial nerve, and the postganglionic branch of the internal carotid plexus. So this postganglionic branch of internal carotid plexus is known as the deep petrosal nerve. Sorry, I just wrote it wrongly here. The deep petrosal is the postganglionic branch of internal carotid plexus, and the greater petrosal is a branch of the facial nerve. Because of the technical difficulty, I just made this error. Sorry. These two branches, they join to form the nerve of the pterygoid canal. So, you know, once there was a question in a latest NEET exam, and in that question, the question was related to a nerve which is known as Vidian nerve. And many got confused that what is this nerve, because they didn't hear about it. This is a very important nerve. This is another name of nerve of pterygoid canal. So if there is a question that the deep petrosal nerve and greater petrosal nerve gives rise to which nerve? So the answer will be nerve of pterygoid canal or Vidian nerve or Vidian nerve. So this Vidian nerve has a great importance passing through the foramen lacerum, right? So foramen lacerum is associated with Vidian nerve, nerve of pterygoid canal. Sometimes they can ask you questions, deep petrosal nerve or greater petrosal nerve. Okay. Is it clear?
Yeah, I have a confusion. Deep petrosal is a branch of postganglionic branch of internal carotid plexus,
Plexus. Yes, that's correct.
and uh, greater petrosal is a branch of facial nerve.
Wonderful. Very good. Yes,
Okay.
correct. Yeah. Okay. So greater petrosal is a branch of facial nerve and deep petrosal is a postganglionic branch of internal carotid plexus. Okay. We'll read about the parasympathetic secretomotor pathways. In that, we'll read about the pterygopalatine ganglion. So in the pterygopalatine ganglion, this nerve of the pterygoid canal, it is associated, right? So how they get connected, how they are associated, and what all structures do they supply, we'll read. And what is postganglionic branch? Postganglionic branch means the ganglia where these structures are synapting together. So the dendrites, right, they synapse with the another neuron in a ganglia, right? So ganglia is where there are synapting, right? So any fibers which are before that synapting thing is known as preganglionic. Any fibers which are after, they are known as postganglionic branches. Okay, so this is a postganglionic branch of internal carotid plexus, okay, which is also known as nervus plexus. Okay, now next is the carotid canal. Okay, now from the carotid canal, very important, the carotid canal, the structures passing are internal carotid artery, internal carotid sympathetic plexus, right? So this plexus, which we were talking about, the internal carotid sympathetic plexus, this plexus passes through the carotid canal. So if you see this red structure, this is passing through the carotid canal. Okay. Then we have the petrotympanic fissure. Okay. Now, if I have to ask you, what is the petrotympanic fissure? In this picture, it is not very clear, but I'll show you a picture where you will be able to see. Now, before making you understand, let me tell you what is this part of the bone, right? This is the petrous part of the temporal bone. So if you see the temporal bone, which I have already shown you, this is the squamous part of the temporal bone, right? This is from the interior. This is the petrous part of the temporal bone. Okay. So this petrous part of the temporal bone, and if you see, this is petrous part of the temporal bone, and this is the tympanic part of the temporal bone, right? So the petrous part of the temporal bone and the tympanic part of the temporal bone, there is a fissure which is known as petrotympanic fissure. Okay. So in this structure, this is the petrotympanic fissure. Okay. So the structure which is associated is the anterior tympanic artery and the cauda tympani. Can you tell me, Neha, cauda tympani is a branch of
Facial nerve.
facial
That
nerve.
supplies tongue.
Very nice. Which part of the tongue?
Mm.
Remember, look, the tongue has three sections: anterior 2/3, posterior 1/3, and posterior most. The anterior 2/3 we have mandibular nerve and facial nerve.
Yeah.
The posterior 1/3 we have glossopharyngeal, and the posterior most we have the
posterior
nasal.
most.
Very
Yeah.
good. Okay, so the anterior 2/3 has the special taste sensation which are supplied by the cauda tympani
Cauda
branch of the
tympani.
facial
Yeah.
nerve. Rest all are supplied by the lingual branch of the mandibular nerve. You remember lingual branch?
Yeah.
Right? The lingual branch of the mandibular nerve. That is the reason the anterior 2/3, the nerves associated are facial nerve and mandibular branch of the trigeminal.
Trigeminal.
Okay. Now, stylomastoid foramen. This stylomastoid foramen is one of the most important foramen, right? Because it is associated with our very popular, which nerve? Neha. Neha, which nerve?
Stylomastoid nerve.
No. Let me open up a color diagram. Tell me. Look, the stylomastoid foramen is a very popular foramen which is related with facial nerve. So facial nerve exit through the stylomastoid foramen. Now, if you see in this picture, the stylomastoid foramen, right? This is the styloid process. This is the mastoid process. So here the facial nerve comes out and supplies the face, okay, through the stylomastoid foramen. Okay. Okay, so the facial nerve and the stylomastoid artery. So the structures passing through this are the facial nerve and the stylomastoid artery. Okay, so this is the stylomastoid foramen. Now, next is the jugular foramen. Now, this is a very important structure. Now, let's first see where actually is the jugular foramen, where we can see it clearly. Okay, so in this picture, let me just zoom in. If we go down, okay, zoom in more. This is the jugular foramen on both sides. Okay, you can see a big foramen, which is the jugular foramen, right? So the structures passing through this foramen there are a lot of structures which are passing. So we will see an enhanced version of this foramen. Okay, we'll see a magnified version of this foramen. If you see here, okay, so let me just zoom in again. And I have a mnemonic here to learn the structures passing through the jugular foramen. Now the jugular foramen, we have the anterior part, middle part, and the posterior part. Okay, so we have the anterior part, middle part, and the posterior part. Okay. Now, the anterior part, we have the interior petrosal sinus, inferior petrosal sinus. Now, as I just shown you the petrosal part of the temporal bone, right? Do you remember? The petrous part of the temporal bone, right? There is a superior portion and there is an inferior portion. On the superior, there is superior petrosal sinus, and on the inferior side, there is the inferior petrosal sinus, right? This inferior petrosal sinus is a type of dural venous sinuses, which eventually drains the deoxygenated blood and the cerebrospinal fluid into the internal jugular vein. So what is happening is this inferior petrosal sinus, it joins sigmoid sinus and eventually go through the jugular foramen through the anterior part. Okay, and eventually drains everything into the internal jugular vein. Okay, so this inferior petrosal sinus, this passes through the anterior part of the jugular foramen. Anterior part of the jugular foramen. Then we have the middle part. Middle part, we have the cranial nerves number 9, 10, 11, and MAP. MAP is the meningeal branch of the ascending pharyngeal artery. So MAP is the meningeal branch of the ascending pharyngeal artery. Okay, so if you see that four structures, glossopharyngeal, vagus, and accessory, and the meningeal branch of the ascending pharyngeal artery. So glossopharyngeal is number 9, vagus is number 10, and accessory is number 11. Anybody who can tell me all the 12 pairs of cranial nerves names? I think
Yeah.
you should know. Yes, tell me.
Yes. Olfactory,
Mhm.
optic, oculomotor, trochlear, trigeminal, abducent,
Mhm.
facial nerve, vestibular cochlear,
Mhm.
glossopharyngeal,
Mhm.
vagus,
Mhm.
accessory, and spinal accessory, and hypoglossal.
Hypoglossal. Okay. So you can learn it by Utafagwa. Okay. So the first three are a little bit sometimes confusing. The first is olfactory, optic, and oculomotor. Right? So LPC. Okay. So olfactory, optic, oculomotor, trochlear, trigeminal, auditory, facial nerve. Right? Which one is this? Auditory. This
Audit
one is abducent. Sorry, I just missed.
abducent,
This
six
is
is
glossopharyngeal,
abducent.
vagus, accessory, and hypoglossal. Okay. So these are the 12 pairs of cranial nerves. Okay, we'll read about the cranial nerves in detail, right? From where they pass and what structures they are, distributing and what is their course, distribution, and everything, right? Now the posterior part. Posterior part you can learn through the mnemonic JOE, J-O-E. So J for jugular vein, right? It says internal jugular vein, definitely, and lower end of the sigmoid sinus. Now, if you see the sigmoid sinus, it is a S-shaped sinus like this. It's a lazy S. This sigmoid sinus eventually drains and go through the jugular foramen and it drains into the internal jugular vein. Okay, so this sigmoid sinus is an S-shaped sinus. This is the petrous part of the temporal bone. So there is superior petrosal sinus, inferior petrosal sinus. So the inferior petrosal sinus passes through the anterior part, right? And the posterior part, we have the internal jugular vein, which is the lower end of the sigmoid sinus. So this is the sigmoid sinus. The lower end, it passes through the posterior part of the jugular foramen. Then we have the occipital artery and the emissary vein. So we can learn it through the JOE, J-O-E. Okay. Any confusion in this? Neha,
No, no.
let me just erase all the drawings. Just give me 1 second. Okay. Sorry for the interruption. Let me close this. Okay. So this was the jugular foramen. So jugular foramen, we have anterior part IPS, that is inferior petrosal sinus. So just remember the structures, just make an image of this interior of the skull so that you never forget it. So the jugular foramen, we have the inferior petrosal sinus. Middle part, we have the 9, 10, 11 and MAP, that is meningeal branch of the ascending pharyngeal artery. Posterior part, we have Job, that is the jugular vein, occipital artery and emissary vein. Okay, so let me ask you some questions. Okay. Now, before asking some questions, let's go through the like base of the skull so that we know some structures which we can see at the base of the skull before going ahead, because there are some foramina, some structures which are associated here. Uh, I have just put one question related to it, which I'll be asking after this, the base of the skull. So just read it very carefully. Also, you will see that how they are asking questions, right? This question is from Dental Dex. Okay, so it is a very important concept to understand. Okay, so let me just show you what all structures are seen at the base of the skull. Okay. Okay, so first is the incisive foramen. Okay, now we have already seen the incisive foramen. Can you tell me which all structures passing through incisive foramen, Neha?
Nasopalatine nerve and artery.
Very nice. Nasopalatine nerve and artery. Then this is the median palatal suture. Okay, this is the maxilla palatine process of the maxilla. This is the transverse palatine suture. So this is the middle palatal suture. This is the transverse palatine suture, this one. Okay. Then we have the palatine bone horizontal plate. This is the horizontal plates of the palatine bone. Now, this is the zygomatic arch, which we all know. This is the greater palatine foramen, this one, okay, through which the greater palatine nerves and arteries are passing. The greater palatine nerve is a branch of which nerve?
Facial nerve.
The inferior orbital fissure. Now, this is the inferior orbital fissure. We have not read it yet. We'll read what all structures are passing. Then we have the infratemporal crest. Now, sometimes, they ask you questions which are related to infratemporal region, right? Infratemporal region is very, very important. We'll understand. I'll show you in the skull how to, imagine the infratemporal region, how to understand where it is located, and how to know what is situated anteriorly, posteriorly, at the roof, at the bottom, or at the floor, on the lateral side and the medial side. Okay, because there are a lot of questions which they ask from infratemporal region, right? Pterygopalatine or pterygomaxillary fissure, pterygopalatine ganglion, any fossa, any fissure, any ganglion are very, very important. Okay, so we have the pterygoid process, that is the medial plate. So this is the medial plate, this is the lateral plate. Can you tell me which bone is this? Which process, like which bone processes? The medial pterygoid plate and the lateral pterygoid plate are the processes of which bone?
Sphenoid bone?
Yes, they are branches of the sphenoid bone, right? So the sphenoid bone has greater wing, lesser wing, and the medial and the lateral pterygoid plates, right? There are other structures of the sphenoid bone. I have a picture here. Let me show you. You see, one second. Here. So if you see, this is the sphenoid bone. So this blue is the body. So this is the body in this picture. Okay, so this blue is the body. This purplish color, I'm not very good with the colors. This purplish color is the greater wing. The small greenish color is the lesser wing, and these are the pterygoid plates. So the sphenoid bone has a body, greater wing, lesser wing, and the pterygoid plates. So in this picture, you can see the body, right? The greater wing of the sphenoid bone, the lesser wing of the sphenoid bone here, right? The pterygoid plates are on the base of the skull, so which we are discussing right now. So these are the pterygoid plates. So middle pterygoid plate and the lateral pterygoid plate. Okay. We were at which structure? Here. Okay. So let's see here. Let me just delete these annotations. Okay. This time I was fast learning the technology. Okay, so we have done this incisive foramen. Okay, middle palatal suture, infratemporal crest, pterygoid plates. So these are the pterygoid processes, or the middle plate and the lateral plate. Okay, now let's see the other structures. Then we have the foramen ovale. Okay, so if you see, this is the foramen ovale. So through the foramen ovale, mainly the mandibular nerve passes. There are other structures as well, which we learned through the mnemonic male, which we'll discuss. This is the pharyngeal tubercle. So this structure is the pharyngeal tubercle, right? Okay. Then we have the articular tubercle. So this structure is the articular tubercle. Then we have the hypoglossal canal. Now, if you see the hypoglossal canal, they have inserted a wire passing through the hypoglossal canal. So just below this, this is the canal through which the hypoglossal nerve passes. So this is the hypoglossal canal. Okay. Then we have the mastoid canal. In the mastoid process, right? Then we have the jugular fossa. Then we have the stylomastoid foramen. This one. So which nerve passes through the stylomastoid foramen? Neha.
Facial nerve.
Facial nerve. Then we have the occipitomastoid suture. We have the mastoid process, mastoid notch. Foramen magnum. Foramen magnum is the biggest foramina, right? There are a lot of structures passing through the foramen magnum, like apical ligament of dens, then some ligaments, also some of the cranial nerves, spinal nerves, vertebral arteries, lot of structures, and they're divided into various sections, anterior, middle, and posterior. So we'll learn about them, right? Okay. So next we have the condylar canal, occipital condyle, parietal bone, jugular foramen. We have already read about it, right? Then we have the external auditory or the acoustic meatus. Then we have the stylet process here. We have the spine of the sphenoid. We have the mandibular fossa. What is mandibular fossa? We'll read right in detail. It is very good importance. Then we have the foramen spinosum, which we'll read in detail. What structures are passing. Foramen lacerum, we have already read. Neha, can you tell me what all structures passes through the foramen lacerum?
Deep petrosal nerve and greater petrosal nerve.
And they join to form?
Vidian nerve.
Other name of Vidian nerve?
Nerve to pterygoid.
Nerve of the pterygoid canal. Okay.
Yeah.
So this is the temporal bone. This is the zygomatic process of the temporal bone. This is the greater wing of the sphenoid bone. Now, this is the pterygoid process. So this is the lateral plate. This is the medial plate. Now, this is the pterygoid hamulus. Okay. So this is the pterygoid hamulus. Okay. Then we have the pterygoid process of the middle plate, maxilla, palatine bone, vomer, and posterior nasal spine. So this is the posterior nasal spine. Okay. Now I will be asking a question which came in one of the exams. Let me see how to undo this. Notations. Yeah, good. Okay, now read this question. This question is for both of you. I want you to answer one by one. let me know when you are done with the question, okay? Are you done? Sorry. Do you want a hint? Neha, Aman, are you done?
Yes.
You want a hint? I was a little bit fast when I was telling you about this because I was about to ask you this question. Now, anything? Remember?
Palatine bone.
Sorry?
Palatine bone.
No.
It must
No.
be the pterygoid plate of sphenoid bone. I'm not sure about
Yeah,
lateral or
very
medial.
good. Yes, yes. Now see. When I was telling you, I was a little bit fast. This is the pterygoid hamulus. So if you see the pterygoid hamulus, let me just annotate it so that you can clearly see. Okay. So this structure is the pterygoid hamulus, right? So on both sides, there is a small extension of the pterygoid plate. But which pterygoid plate? Medial or lateral?
Medium.
Very good. Medial. So now you have seen that they ask questions which is not very common, right? So we have to be very careful. And he is just, making it a little bit complex by just saying that a prosthodontist design maxillary removal complete and partial dentures to engage the hamular notch behind the maxillary processes. That's right. The hamulus is a small slender hook which accommodates the action of the tensor villi palatini. The hamulus is a component of which bone? Now this question looks a little bit clinical, but actually it's related to a very basic concept that if you know that where is this hamulus located, you can easily answer this question, right? That the answer is medial pterygoid plate of the sphenoid bone, right? So now we know that the sphenoid bone has medial pterygoid plate, lateral pterygoid plate, right? The greater wing, lesser wing, and the body. Okay. There was a similar question which I had already put, in this presentation, which I will ask later on, right? So that you forget some more things and then we'll go there. Okay. Now let's go to the foramina again. Okay, let's review the jugular foramen. Okay, Neha, can you tell me all the structures passing through jugular foramen?
Internal jugular vein.
No, it is divided into three parts.
Okay, in parts, yeah. Anterior part, posterior part, and anterior part, middle part, and posterior part. In anterior part, it's like we remember it as IPS, inferior petrosal sinus.
Very good.
Middle part, we have cranial nerves, three cranial nerves, 9, 10, and 11. And meningeal branch of ascending, if I'm not wrong, ascending pharyngeal artery.
Map.
Pharyngeal artery, yeah.
Yeah,
Map.
so remember 9, 10, 11, map.
Map.
And the last was?
Joey.
Joey or Joe.
Jugular vein, occipital artery, emissary vein.
Very nice. Now, emissary veins are always like very important in terms of spreading the infection. We'll read about them like at a lot of places, right? Where the infection spreads and it directly goes to the meninges and the brain, right? So emissary veins have a lot of importance. They are valveless. They don't have any valve. Okay. We'll read about them. Okay. Okay. Let's go ahead. Very good. Okay, so we have the mastoid foramen, again emissary vein, right? Hypoglossal canal. Now, if you want to see the hypoglossal canal, let me show you. Okay. Yeah, so let me zoom it. Now, if you see this side, we have the hypoglossal canal. Okay, so if you see the jugular foramen, right, just go more medially and down, that is inferiorly, you will see the hypoglossal canal. Okay, through the hypoglossal canal, let's see what all structures are passing. So if you see the hypoglossal canal, the hypoglossal nerve and venous plexus of the hypoglossal canal. So technically, the hypoglossal canal passes the hypoglossal nerve. Then we have the condylar canal, where the condylar emissary vein is passing. Foramen magnum is very, very important. We'll learn about all the structures passing through foramen magnum. Let me just show the foramen magnum in detail. Now, this is the foramen magnum. Now, the structures passing through foramen magnum are divided into three parts. Okay. We have the anterior part, and we have the subarachnoid space, and then we have the posterior part. Right? To the anterior part, we have the apical ligament of dens. Anybody who can tell me what is dens? Neha.
No.
Neha, Raman, anybody? Neha, you are on mute mode.
Is that dens in dente?
No. That's different. It's dens and dente is related to a tooth. This is related to cervical vertebrae. You remember cervical vertebrae? We have C1, C2.
Yeah.
Right? The C1 is known as atlas, and the C2 is known as axis.
Axis.
Right? So there is
Yeah.
an odontoid process, extra process, which is located on the body of C2. This is known as the dens. Known as the dens. And there is a ligament which is associated with apical ligament of dens. Okay. So when, like, for example, when I move my neck like this, it is rotating on, on dens, right? So this apical ligament of dens has a very importance, and also during the hanging, part, the hanging of the people, what I call strangulate, when you strangulate somebody and they hang themselves, right, when they die. So this dens, it breaks and it goes inside the medulla, and then it makes the person die, right? So this has a clinical importance. So this is very important to understand what is dens. It is a part of cervical vertebrae. We'll read about cervical vertebrae as well, right? The typical and the atypical cervical vertebrae, right? Some are typical, some are atypical, right? So we'll read in the next session. Okay. Then we have the superior band of the cruciform ligament and membrana tectoria, right? So these three structures passes through the anterior side. Then we have the subarachnoid space. Now, this is the durameter, arachnoid meter, and pyometer. You can learn it from outer to inner. You can learn it through the mnemonic tap, right? The durameter, the meninges, that is the arachnoid meter, and the pyometer. The subarachnoid space means below the arachnoid, right? So we have the subarachnoid space. This subarachnoid space, we have the structures which are passing are the spinal arteries, right? Vertebral arteries. Then we have the spinal root of the accessory nerve. Posteriorly, we have tonsils of cerebellum and medulla oblongata. Okay, so we have tonsils of cerebellum, medulla oblongata. Okay, so we have tonsil of cerebellum, medulla oblongata, spinal root of the accessory nerve, vertebral artery, and the anterior spinal artery, right? And then we have the apical ligament of dens, membrana tectoria, and the cruciform ligament. Okay, is it clear?
Yeah.
Okay. And as I told you, this is the subarachnoid space. Right, we have the subdural, which is below the durameter is subdural. Below the arachnoid mater is the subarachnoid space. Okay, so these are the various structures which are passing through the foramen magnum. This is very important to understand. Okay. Now let's go back. Okay. Now, after foramen magnum, we have the foramen, which is known as a jugular foramen. Then we have already done jugular foramen. Then we have the internal auditory canal. We have the vestibulocochlear and the facial nerve. Now, during the facial nerve course and the vestibulocochlear, we'll learn about these two nerves. There are three openings actually, and out of those two, one, the facial nerve and the vestibulocochlear nerve, they pass through this internal auditory canal. Right. So there is external auditory canal and internal auditory canal. These are located in the petrous part of the temporal bone. So if you see, this is the petrous part of the temporal bone, and here we have the internal auditory canal, which is located. It is more clearly visible in other pictures. I'll show you in a little while. Okay. Then we have hiatus of the canal for greater petrosal nerve, right? So this is the hiatus of the canal for the greater petrosal nerve, right? Then we have the, okay, who will tell me greater petrosal nerve? What is greater petrosal nerve? Whose branch?
Branch of branch of facial nerve.
Facial nerve. And also, like if you see that this is the hiatus, right? And it is located very close where to the facial nerve, where it is like, you know, entering the internal auditory canal, right? The facial nerve, right? So this is very close. So one of the branches, this is the hiatus for greater petrosal nerve. And we'll read them in detail, what their supply are, how they are related to, you know, the secretomotor pathways, the parotid gland and other glands. So we'll see them. Okay. Now, again, there is a hiatus for the lesser petrosal nerve, right? Then we have the foramen spinosum. So if you remember, I told you there are four foramens, R, O, S, and L, right? So on the top, on the anterior side, which one we have? Rotundum. Then we have ovale. Then we have spinosum. And on the middle side, we have lacerum. Okay. From the foramen spinosum, the structure passing are middle meningeal artery and meningeal branch of mandibular nerve. So spinosum is MM. Okay. So middle meningeal artery and meningeal branch of mandibular nerve. Okay. So mandibular nerve, meningeal branch passes through the foramen spinosum. Then we have the carotid canal, which we have already learned about. Foramen ovale, right? Usually we used to remember it through male, M-A-L-E, but the main structures which are passing are the mandibular nerve and lesser petrosal nerve. Okay, so the mandibular nerve and lesser petrosal nerve passes through the foramen ovale. Foramen rotundum is specifically for maxillary nerve. Okay, so we have four foramens, right? Foramen rotundum, foramen ovale, and foramen spinosum and lacerum. So what passes through foramen rotundum? Neha.
Axillary nerve.
Foramen ovale.
Mandibular nerve.
And
lesser petrosal nerve.
Lesser petrosal nerve. Yes. What passes through foramen spinosum?
Middle meningeal artery and meningeal branch of mandibular nerve.
Very nice. Middle meningeal artery and meningeal branch of mandibular nerve. Okay. What passes through foramen lacerum?
Deep petrosal nerve and great petrosal nerve. Greater petrosal nerve.
Greater petrosal. So deep petrosal and greater petrosal.
Greater petrosal.
Now, to make it a little bit, interesting, let's review all the foramens again so that we don't forget. I'll ask you some questions. Incisive canal. Now you have to be very fast. Now you have learned about them.
Nasopalatine nerve.
Very nice. Greater palatine foramen.
Greater palatine nerve and artery.
Lesser palatine foramen.
Lesser palatine nerve and artery.
Foramen lacerum.
Deep petrosal nerve and greater petrosal nerve.
Foramen spinosum.
Middle meningeal artery and meningeal branch of mandibular nerve.
Carotid canal.
Internal carotid artery and internal carotid plexus.
Very nice. Okay. Stylomastid foramen.
Facial nerve and stylomastid artery.
It's okay. You can read it, yeah, as well, right? Okay. Jugular foramen.
Anterior part IPS, middle part 9, 10, 11 MAP, posterior part Joey.
Very nice. Very nice. You will never forget it now. Okay. So mastoid foramen, they never ask it. Hypoglossal canal, we know hypoglossal nerve. Condylar canal, they never ask it. Foramen magnum is very important. Let me ask you foramen magnum again. Yes, tell me.
Foramen magnum is also like anterior part.
Yeah.
It's a apical ligament of dens and
Ligament of dens, yeah.
yeah,
Cruciate
and
ligament.
pardon me,
Cruciate ligament.
cruciate,
Cruciate,
yeah,
right?
cruciate
Cruciate is
ligament,
there, right? No, cruciform. It's not cruciate.
cruciform, yeah, I
Cruciform.
was,
And
yeah,
and
and
membrana tectoria.
membrana tectoria, yeah, membrana tectoria.
Okay. Through the subarachnoid space.
So spinal accessory nerve and vertebral arteries. And
Very good.
branches of spinal artery, anterior and posterior branches.
Very nice, very nice. And to the posterior part?
It was the lower part of medulla,
Very good.
meninges,
Excellent.
and tonsils of
Excellent, excellent. Tonsils
cerebellum.
of cerebellum.
Cerebellum.
Excellent, excellent. Wonderful. So now you know foramen magnum. Okay, now we are left with superior orbital fissure, right? Let's do that as well. Okay. Now to see where is the superior. So the superior orbital fissure is here. Okay. So this is the superior orbital fissure. Okay. Now let's see what all structures passes through the superior orbital fissure. Now in this diagram, if you see, this is the superior aspect, this is the lateral aspect, this is the medial aspect, and this is the inferior aspect. Okay. Now the above one, this is the superior orbital fissure, and this one is the inferior orbital fissure. Okay. And this is known as the tendinous ring of Zinn. Okay. The superior orbital fissure through this superolateral aspect, structures passing are lacrimal nerve and the frontal nerve, which are parts of, tell me, you know that? Lacrimal and frontal are parts of?
Fissure nerve.
No, they're parts of ophthalmic division of mandibular nerve, right? Lacrimal and frontal are parts of ophthalmic division of
mandibular nerve, mandibular branch of trigeminal nerve.
Yeah. Then we have the trochlear nerve, which is cranial nerve number 4. So technically we have cranial nerve number 4, cranial nerve number 5. Okay. Then we have the tendinous ring, which we have these oculomotor nerve, superior and inferior division. So we have cranial nerve number 3, right? Then we have the nasociliary nerve, which is a branch of, again, trigeminal nerve. Okay, this is a branch of trigeminal nerve. Now, this nasociliary nerve or ophthalmic nerve, the ophthalmic branch of the trigeminal nerve. Okay. Sorry, here also it was trigeminal. I wrote mandibular. Sorry, my bad.
Yeah.
Ophthalmic division of the, you didn't tell me.
Trigeminal.
If I'm wrong,
I was saying trigeminal nerve.
Yeah, I'm sorry, my bad. Okay, so this is the nasociliary branch of the ophthalmic division of the trigeminal nerve. Okay, now this is, so we have 3, 4, and 5, right? Cranial nerves. Then here we have the inferior ophthalmic veins. Okay, so these are the structures which are passing through the superior orbital fissure. Okay, other is the superior ophthalmic vein which passes through here, and the inferior ophthalmic vein which passes through here. So basically the ophthalmic veins, the superior and inferior, passes through superior and inferior aspects, right? Because they are superior and inferior. So we have 3, 4, 5 cranial nerves passing through the superior orbital fissure. Okay. Now here, now let's see what all structures we are left with now. Okay. So last we have the optic canal. Now there are two things which are passing through the optic canal, which is the optic nerve and ophthalmic artery. Always remember, optic nerve and ophthalmic artery passes through the optic canal. So OO. Okay. Then we have the cribriform plate of the ethmoid through which the olfactory nerve, anterior and posterior ethmoidal arteries. Okay, so olfactory nerve and anterior and posterior ethmoidal arteries. So here we just end our osteology.